Welcome you all once again to this MCQ discussion series where we bring you the most important PYQs that have been part of the previous examination. So straight away we'll go towards the MCQ. Dystrophic calcification is seen in all except. So the examiner is trying to ask you whether you know about the examples of dystrophic calcification or not. So the options were atherosclerosis, lymphoproliferative disease, renal disease, and the carcinoma thyroid. So the answer here is renal disease. Okay, so that means atherosclerosis, lymphoproliferative disease, carcinoma thyroid, all are having a dystrophic calcification. Okay, so now why it is happening? Our motive is not only to read the answer, but to know why it is the answer when certain kind of questions are given, and why not other part which is not the answer. So atherosclerosis, we all know there is an intimal calcification which is happening. Also we know that there are death of the smooth muscle cells, and the calcification which happens in the dead tissue is known as dystrophic calcification. Okay, option number 2, that is the lymphoproliferative disease. In the lymphoproliferative disease, like Hodgkin lymphoma and non-Hodgkin lymphoma, there is a piece of necrosis which is happening inside the lymph nodes, inside the spleen, and the calcium getting deposited in the dead and the necrotic tissue is dystrophic calcification. Now, option number 4, which is carcinoma thyroid. Per se, any carcinoma, whether it is thyroid or any other carcinoma, it is again having some dead and necrotic tissue. So the calcification happening in the dead and necrotic tissue is dystrophic calcification. For dystrophic calcification, you need to remember only 2 points. First, it is happening in the dead and necrotic tissue. Second, the calcium levels are normal. Now, the fourth option, which is the renal disease, why it is the answer? Because metastatic calcification is happening in renal disease. So in the renal disease, calcium is getting deposited as a virtue of hyperparathyroidism that is induced secondarily in the renal failure, renal diseases. Hence the calcium which is getting absorbed in the renal disease into the kidneys is by the virtue of hyperparathyroidism. That is why it is of metastatic calcification variety. Two things that you need to remember about metastatic calcification is it happens in the normal tissue with excessive elevated calcium is seen in those cases, in contrast to dystrophic calcification where the calcium levels are normal but it deposit in the dead and the necrotic tissue. Keep revising these MCQs with us. See you in the next video.